Afternoon all. Today we are here for the 8th series of this online guest lecture. And today, on behalf of Department of Panchakarma, I welcome you all, dear students, and those who have joined online. I can see the many stalwarts of Panchakarmas are there to listen our guest today. And we have today Dr. Swapnil Auti, Assistant Professor from the All India Institute of Ayurveda, Goa. Dr. Swapnil has completed his PG from Panchakarma and PhD from IPGTNRA Jamnagar, which is ITRA now. And he has published around 23 papers, research papers in reputed journals. He has participated in 52 seminars and CMEs, and he got 2 best paper presentation awards also. And what I know about Dr. Swapnil is he's so sincere and so dedicated for the Panchakarma. But like when we were in Jamnagar, I was having Basti in my PhD topic and he was having Basti in his PG topic. So he used to prepare Basti in home in the morning, and 7:30 or 8 o'clock we used to come and give the Basti to the patient. So that's how he is so sincere and dedicated for Panchakarma. It's really our pleasure to have Swapnil for today's guest lecture. Over to you, Dr. Swapnil.
Thank you very much, ma'am, for the introduction. So, first of all, I would like to thank IMS Faculty of Ayurveda, IMS BHU, and Dr. Rajkala Madam for giving me this opportunity to present in this evidence-based Panchakarma video lecture series. I will directly start with my topic. So, Basti Chikitsa is considered as a main Chikitsa in Ayurveda. So it is very important to know exactly where to give the Basti and how to give it, and what are the conditions that we should meet while giving this treatment to any particular patient. So I'll go through one presentation. So we'll discuss along with that. If you have any questions, you can ask me anytime. So I'll just sharing my screen. So here are some common questions and queries actually students ask, or they come to our mind while we are giving the Basti therapy, that what should be actually it is a therapy for gut. Okay, so we are giving the therapy for Pakwashaya. So what are the prerequisites regarding gut to administer the Basti that we must think in today's science light actually? Otherwise, there is a lot of things written in Grantha, but we have to go through that very deeply, and we have to make the conditions which are easily understandable by everyone, even the modern science peoples also. So what should be those requisites? We have to mention those, we have to actually test those things. And there are some other questions like, can we directly start the Basti therapy without giving any Virechana, Vamana, something like that? Or what should be the optimum quantity of Nilu Basti? In Shastra it is mentioned, but is there anything beyond that or below that we have to discuss? Then Basti can be given at night, because there is a practice in various institutes I have seen, people giving Anuvasan Basti even in the night. And so many other practices are there. So we'll discuss if there is something wrong or it is justifiable, or why to give Anuvasana after food is a common question. We know answer, of course. Then what are the other modified methods of the Basti? Can Basti be used as a Shamana Chikitsa also? And what is Utlesh in context of the Basti therapy? So why to make the Basti in Kharal? That is one important question asked by many students. And so, do this Basti, how it acts? So what will the mode of action of the Basti? Do it get absorbed? What are the role of this Prakshepa and all? So these are some questions I have given here. So we'll go one by one and we'll add something to it. So I hope you will have many questions after this presentation. So this is the main requisite, or what you can think about Basti, why Acharya have prepared it. Actually, Ayurveda is basically especially these Panchakarma therapies, they are nothing but enhancing the nature's own cleansing methods. There are various methods naturally we have Mala Pravartan, that is excretion methods, like urination, like feces, like sweat, like any other method, like we are inhaling, exhaling. So this exhalation is also a type of excretory method. So similarly, the major part, that is Pakvashaya, plays a vital role in excretion. So whenever you are learning in Charak Samhita, this thing, Ahar regarding the digestion of ahara. There are certain steps in digestion. So whenever it comes to pakvashaya, it is said that pakvashayam tu praptasya shoshamanasya vandina paripindita pakvasya vayu sat katu bhavatah. So vayu is actually produced in the pakvashaya. So whenever it is produced in the pakvashaya, Acharya says na, so there is a term called as katu bhava. Katu bhava means whatever is formed in pakvashaya, that is all is katu bhava. It may be anything. It may be anything. Actually, the vitamins, whatever is prepared with there, it comes under katu bhava. So whatever the bacteria are present there, whatever the gut flora is there, whatever the chemicals produced by that gut flora, and whatever is present in the pakvashaya, that all comes under katu bhava. There are gases, there are food particles which may be digested, which may be undigested. So everything comes under this katubha. So this katuta is actually giving rise to the vayu, which is actually an entity that works in every function of the body, right? So Panchakarma people actually, they should visualize vayu, though it is not visible, but for us it is necessary to show the vayu to the peoples because we are removing it from the body. So what we are removing, actually we are removing this thing, katubhava, from the large intestine or colon. Okay. So after removal of this katubhava, it is generally seen that the strength of the vayu get diminished. Means whatever the vikrit vayu is there, it gets weakened. And after that, those diseases which are because of the vayu, they may come under control. So it prepares actually a favorable condition for those diseases to get reduced, and body has its own method to heal itself. This is just a boost that we give through the basti by removing this katubhava so that body can heal itself. Okay. So basically we are not intended to give any medicine to the patient. We are actually intended to prepare a condition in the body so that it can heal, right? So this is the prime objective of doing this therapy. This is how we prepare this therapy, right? Panchakarma. Like pitta is produced in the small intestine, we prepare virechana for it. Kapha is produced in the what you can say as stomach. Okay, that is a ama what is prepared in stomach. So to remove that, Vaman is the easiest method. This is how the Panchakarma is formed. So Panchakarma acts mainly over the koshtha, right? So we have to bring dosha from shakha to the koshtha and remove it from koshtha. So koshtha we are treating actually. So what are the prerequisites regarding gut? So gut should be healthy. This is the first prerequisite. If we are bringing the dosha from shakha to the koshtha and then removing them from the koshtha, then gut should be healthy. If gut is not healthy, then it may be difficult for us to remove the dosha. However, there are some diseases like ulcerative colitis where gut is not healthy. There also we administer the basti, but that is having the local action rather than more of a systemic action. If we want strong systemic action from the basti, the gut should be healthy. In such cases where we give local bastis like picha basti and all, we first treat that gut, right? And then the basti has its actual effect. Okay. So Sroto Mukha Shuddhi is termed in Ayurveda. That should meet first. So gut must be nirama and healthy and capable to remove the dosha effectively. So this is what is the difference between small intestine and large intestine, because we are talking nowadays a lot about this gut microbes and microbiome theory of disease production. So we must discuss what is the difference between gut and means small intestine and large intestine, because there are most of the microbe load is there in the small intestine, but the density is more in colon. And the main difference between these two is the function, because see, we give basti in most of the cases like rheumatoid arthritis, which is a autoimmune disorder, or even some cases where is a kidney disorders are there. There also autoimmunity, if it is there in the picture, basti is our prime treatment. However, we discourage giving basti in cases of psoriasis, especially the anuvasana basti. So there is something in the colon that we have to look upon. So the thing is the immune reactions that are taking place, because there are so many bacteria, some are identified, some are not identified. They have a lot of function like this fermentation of undigested polysaccharides, production of short chain fatty acids, certain vitamins also. And there is a very important function, that immune tolerance and regulation, because the gut microbes that are present in the large intestine especially, they have the role in autoimmunity, because immune tolerance is a property that some bacteria make body to have. If those bacteria are not present there, immune tolerance won't be there. So this is a very important function. So sometimes what happens is this thing, dysbiosis. Means the bacteria which actually causes inflammation, the bacteria which actually causes the diseases, they get enhanced in the size disproportionately, and those bacteria which actually suppresses the immunity or which regulates the immunity, they get diminished in number, and that is called as dysbiosis, imbalance of microbiota. Then there may be something because of the suppose inflammation is there, or some medicines we are taking which is causing damage to the gut, and that causes the increased intestinal permeability, which is the effect, or because of which some bacterial fragments or something which is exogenous material that goes inside the blood vessels and that behaves like an antigen. Okay, and there may be some molecular mimicry with the human body, and that triggers the autoimmunity. Because suppose if a patient of rheumatoid arthritis is there, and there is a leaky gut or increased intestinal permeability is there, and because of which something is going inside the body, we don't know what it may be, and it has a molecular mimicry with your joint cells. Okay, then there may be trigger to the autoimmune, because body acts against that exogenous material, same reaction hampers to your joints also. So there may be chronic inflammation in the gut. That is also one of the important trigger, because inflammation plays a vital role in the production of these autoimmune disorders. And loss of regulatory T cell function. These T cells, they have a suppressive activity in the immunity. So if there is a loss of this regulation of the T cell function, there may be autoimmune disorders. They get flared up with these factors. So these are the main factors we have to keep in mind while planning the Basti. Why I am explaining this, I will come to that. So one more important thing is that the germ layer. Because see, there are certain diseases which are specifically seen in some specific part of the germinal layer. Suppose I'm having psoriasis. Psoriasis is more in the skin, right? That is also the superior part of the skin. Like epidermis is very widely affected, some part of the dermis also. So the ectoderm is the major layer which is involved in psoriasis. So similar kind of the ectodermal tissue is seen in our ectoderm derived neural crest cells which are present in the colon. That is a part of enteric nervous system, right? So if you are having a disease like psoriasis, the nervous system has to be tackled first, because there are ectoderm which is related to this. The enteric nervous system is also showing the presence of these things. So the nervous system is the one where you should act upon largely in case of psoriasis. Whereas in case of rheumatoid arthritis, there is a relation of mesoderm, because mesoderm is basically related to the synovium, cartilage and bone, and that is also present in some form in the colon, like muscle layer, blood vessels and connective tissue. Not exactly the mucosal lining, because that is the endodermal tissue, right? So these are the two concepts that we can see. And what we can, one more concept I am putting here. So I am burdening you with the concepts right now. I will explain why I am giving these things. There is one more thing that is related to microbes. We are giving some kind of the herbs in the form of kalka. It may be dry herbs. Some people use churna in the form of kalka. We also use the churna in the form of, in place of kalka actually. Some people use green kalka in preparation of the basti. Okay, so all this contains basically the fibers. Okay, because if we are preparing a kashaya out of that medicine, that kashaya doesn't have that much part of this fibers. And this thing, kalka, they have maximum number of fibers. Okay, so these fibers are actually meant for feeding the microbes. We are actually feeding the microbes when we use the fibers in the basti in the form of kalaka. So I have given the list here. You can see very easily that certain type of the microbes which are identified, they fed upon the particular type of the herb that we are using, and that is having special effects also. Like you can see in the case of ashwagandha, it feeds the lactobacillus plantarum, and it shows that it is working on the gut brain axis support, and it makes the body to have stress resilience. Okay, so this is how the ashwagandha acts majorly on it is called as a adaptogen. Okay, so this property majorly comes from this thing. That is why we generally advocate our patient not to take ashwagandha tablets or something like ashwagandha arishta, because these are purified forms, right? So there are less number of fibers available. So if you give raw ashwagandha root, or you give ashwagandha churna, it contains maximum number of fibers. They can feed the particular type of the bacteria, and that is helpful for the patient to adapt to his diseases actually, right? So these are the main properties we have to keep in mind while planning the basti therapy. So this is the question. I was setting actually the prerequisite for this question. So can we start the basti therapy directly? That is the question basically. So in Charak Samhita, Acharya have clearly said that Sroto Badhva Nilam Rudhyat Tasmat Tam Anulomayat. This is in Vatvyadhi Chikitsa Adhyay. Durbalo yo avirecha syat tam niruhahi upachare. So Acharya also looks for Virechan first. Virechan is the first treatment for them to treat the Vatvyadhi, and then he comes to that statement that Durbalo yo avirecha syat tam niruhahi upachare. So cleansing the colon is the prerequisite as per Acharya also. Okay, so if that is not possible due to some reason, then we must go for niruha. So in some cases where actually there is adherence of some kind of arm in your colon or your small intestine, then you must go for some kind of the Koshta Shuddhi. I am not telling that always you go for first Virechan and then Basti. You can simply do 2 days or 3 days Koshta Shuddhi with Eranda Sneha or any drug of your choice, and then you can start with the Niruha Basti, especially where there is AMA involvement. We use this concept for rheumatoid arthritis patient, because we have seen that if you start directly the Basti therapy, sometime it happens like the symptoms get aggravated. Okay, then you have to be very particular about the Basti, the Kalpa of the Basti. But if there are some mixed picture of the things in the Amvat, and you have to give a Basti which is other than Vaitran Basti, suppose, then you have to use this concept surely. Because if you start some other kind of the Basti other than Vaitran Basti, then it may be difficult, or sometimes symptoms get aggravated. So first you have to give 2 days of Koshta Shuddhi, and after 2 days of Koshta Shuddhi, you can directly start with your Basti therapy. Okay, so even in some cases where there is a kapha, meda, or if patient is not suitable for snehana, in such case we cannot go for snehapana, right? For if we are not going for snehapana, then we have to directly jump onto the Basti therapy. This is the indication of directly starting the Basti therapy, and we know that Asthapan is a best therapy which we can actually make the permutation and combinations, and we can tackle all those contraindications which are there. We can definitely tackle it. So I'm giving the example of Vaitran Basti actually. See, in Vaitran Basti, what Acharya have done is, they have kept nothing to feed the gut bacteria, nothing to feed. Why? See, because they have removed honey, right? Honey is a good tonic for those gut bacteria. But in rheumatoid arthritis cases, actually Acharya is actually intending to remove all the bacterial colonies which are there in the colon. Why? Because there is a dysbiosis. Disproportionately increase the number of these microbes. So they actually want to remove it. So that is why they have added jaggery. Jaggery is actually having a Virechak property. So because of which the whatever is there in the colon, it is removed. Okay. And if you are doing Koshta Shuddhi, it is better. If you are not doing Koshta Shuddhi, then also that basti is good. And you can see that in Vaitran Basti, actually there is no kalka. Chincha kalka is there. That is not a proper kalka as we can see, like ashwagandha, or you use something puto yavanyadi kalka. We only use chincha kalka. Chincha itself is having some corrosive type of the properties, right? So it's so that is why we are not feeding those gut bacteria. We are just doing the shodhana of those gut bacteria completely. Okay, so that is the thing you have to keep in mind wherever there is shodhana needed. Okay, and no feeding for the gut bacteria is needed. I will give you simple logic wherever there is langhana is indicated, because see, langhana is basically a therapy that kills the gut microbiome. Okay, especially it never sees the good bacteria, bad bacteria. It kills all. Okay, because the gut microbiome or the gut microbes, they actually need fibers to feed. So if we are not giving the fibers, they are going to die. Okay, so wherever langhana is needed, we have to go for Koshta Shuddhi, and then the basti therapy we have to plan. This is a simple logic that we can have regarding planning the this basti therapy. Now, how clinically we can apply this? I am just giving one case here. It was simple case, not simple actually. It is a nephrotic syndrome, very difficult to treat. So this is a report of kidney biopsy. The patient was having a lot of increased, his urine protein excretion was very high, and we planned for some basti kalpa. Okay. Now see here, the patient's clinical condition is like that. Patient is having shoth all over the body, right? He is not at all suitable for any type of the sneha. So I cannot go for Virecham. Now we have to give some kind of the basti only in this type of the patient if we have to treat the patient. So we prepared some preparation like this, and see, honey is there, salt is there, kalka is there, tipli is there, kasha is there, and prakshep. Prakshep we use some Chandraprabha like tablets. Chandraprabha is basically, we choose it because it is having Shilajit. We wanted Shilajit as a prakshepa. We don't have it, so that's why we use Chandraprabha Vati in that. And Kashaya was Punanavashtak Kashaya, which is having direct role in such type of the diseases. Okay, so we choose this type of the basti, and we gave basti continuously without any anuvasana. Okay, so we never give anuvasana in these cases because there is shoth, contraindication of anuvasana is there completely. So we gave basti directly without any virecham. Okay, and still we got the results. So these are the results. So that is why basti is called as na basti samam kinchit karma marama palipalanam asti. So you have to use it with, you have to use it wisely. If you are doing basti therapy, if you are doing it properly, then there may be good results. Like you can see here, the urine protein creatinine ratio in the last line, you can see that, and the urine protein, random urine protein, we can see it was 280 initially, it becomes to 37, though it is higher, but still clinically this thing considered as a normal, because patient has no symptoms, then only mild low sodium is there, that can be managed with managed clinically very well. So these are the factors that we have to keep in mind. Now I am also proving one point, how the basti is good for internal organs, especially what we call in Ayurveda as marma. This was the experiment I did in my PG thesis. We have given some basti in rats, okay, and we fed them with extra pure cholesterol. So this is the condition of the animal which was not given the basti, and this is the condition when we give the basti to the animal. So when we give the basti, we have given for 21 days continuously, and after 21 days, this is the condition of the animal with because of the cholesterol. So this much was the damage naturally that was going to happen, but here you can clearly see there is no damage. At least visibly it is not seen. In microscope, this is the picture. You can clearly see that in cholesterol control there is lot of damage. This is all damage. This is all damage. Okay. So in middle two slides, you can see that. And this is the treated one. It is almost okay. Almost okay. Right? So this is how the basti protects the internal organs if it is given properly. Now, this is a very, what we can say as a question or what we say as many, I have seen many big Vaidya, they are doing Basti in comatose patient, right? So it is for those great peoples who are giving Basti in comatose patient, but in Shastra, actually it is contraindicated in comatose patient, but still they are giving. Then why they are giving? They are not treating Vata there. Okay. Vata is actually diminished in those cases. Patient is lying down on the bed. He is not in his senses. He is in matta, murchita like avastha. So chittopaghat is there. In such cases, basti should not be given. It causes vyapad. This is what Ayurveda says about basti, right? So for us as a clinician, we should not actually go for basti in such cases. But why people give? They give to create a mental shock. Because see, whenever you can't put anything inside the brain directly to make it in a shock condition, so instead that we are touching the enteric nervous system, which is present in the gut or colon, right? So if we are touching the system there, it may create a mental shock or it may cause some kind of the stimulation. But rather than shock, we can say that it is causing some kind of the stimulation. So in those references, it is okay to give the basti in comatose patient. But if you are treating something and patient is not in his senses, then it is not good, right? Now see, can basti be used as a shaman chikitsa? So first of all, we have to be sure basti is shaman or shodhan. This is the big question. I also had this question because generally we term as panchakarma is prayashaha shodhanam, right? Basti is also like that. Panchakarma is prayashaha shodhanam, not always shodhanam, correct? Because anuvasana is actually a shaman chikitsa. It does shodhana of only malas, okay? So it can cleanse the vata only in gut, whatever is present in the gut, but it is not actually a therapy that can remove the vata from all over the body because it is a shaman type of the therapy. So basti can be seen in the view of shaman or shodhan also. Because see, the definition of panchakarma is what? Bringing the dosha from shakha to koshta and removing them out. That is why Rakta Mokshana never falls in the category of panchakarma. It is a shodhana. It is not panchakarma. In panchakarma, basti is there, vaman virechan is there, and nastya is there. We have two types of the basti. That's why 5 panchakarmas. Okay. So also one important practice I have seen in my UG days. It was Gomutra Arka Basti given in Shvitra cases. I have seen good results with this thing. Our physician was there. He was giving Gomutra Arka Basti in a dose of 20 ml only in alternate days in Shvitra patient. Now, here also, the purpose of giving the Basti was not actually the Vata Shaman. It is actually Rukshan. Because see, Vata can increase with this practice, but we exactly want that sometime because we have to increase the Rukshana property of the Vata. Okay, Rukshana property in the body. Okay, that is why this type of the basti is planned. So while planning such type of the bastis, this is the answer how you are planning this thing. Because see, the major difference between Langhana and Rukshana is what? Jal Mahabhut. In Langhana, Jal Mahabhut may dominate, but in Rukshana, Jal Mahabhut is always dormant. Okay, so in Chatushprakara Sanshuddhi also, there is Langhana mentioned. Okay, so Rukshana is something different. Rukshana, we have to remove the Jalmahabhuta as much as possible. So if we are giving Dwadash Prasvit Basti with lot of water in it, then that may not cause that much type of the Rukshana, right? For that, you can remove all the contents of the Basti and you can simply put what we use in Prakshepa, that is Gomutra, okay? And that can be administered in low doses. So that is actually this Rukshana therapy. If you are giving Gomutra, it has to be given in 100 to 200 ml doses. There we were giving Gomutra Arka. That's why the dose was less. Otherwise, actually what we have did is we have removed all the parts of the basti. We have just kept the Prakshepa. That is in the form of Gomutra. Okay, so if we use Gomutra, it is Rukshana because whenever you administer the Gomutra, patient will have loose motions and water content of the body is getting reduced. It is not actually increasing. Otherwise, general basti is what we use, like Dashmuladi basti or anything that increases clay in the body. That is why they are contraindicated at maximum instances. Now see, I have seen one more practice regarding Basti therapy is giving only kashaya, adding nothing to it. I mean, no honey, no sneha. Is it ethical? Actually, it is not. Because Acharya clearly given the Basti Sammelan Kram, Makshikam, Lavanam, Sneham and all. And they have mentioned only Prakshepa lastly, and Prakshepa to be added or not to be added, that is up to the physician. But all the contents, they have to be there. But there is one reference of Churana Basti, where Kevala Dravena Diyate. They call it Kevala Dravena Diyate. In such instances, we can use Basti. So there is a classical reference of giving only Basti with some powders or some kind of the kashaya that you can administer. So there is a reference, but they have to be wise, because see, we are not going to get those all the effects of the Basti. Some part of the loss in the effect will be there. So if we are using Dashmukhat with Sandava without any honey, kalka or taila in the management of osteoarthritis like cases, there will be relief, because Dashmula is having its own action. So it will have, there may be gut cleansing that is causing the dysbiosis cure. So because of which this Samta is also getting reduced. So this kind of the effects will be seen, but that has to be used wisely. Okay. Now see, optimum quantity of the Basti. So Niro Basti, it is generally Dwadash Prasruti. Okay, we should not go beyond Dwadash Prasrut. It is said in Samhita. However, how this quantity came, that is a big question. So in Acharya have given so many references like Shar Basti, Vaitran Basti, which is the Ardha Matrika Basti, or Padahina Basti, like Madhutaidika Basti. Or there are Prasrut Pramana Basti, like Pashta Prasrutiki, Nava Prasrutiki, Chatu Prasrutiki, Shat Prasrutiki. So see, as the potency or as the corrosive nature of the Basti is getting increased, the dose is getting reduced. Because Shar Basti and Vaitran Basti, they are more like a irritant type of the enemas. Okay, so their dose is less. And what we generally give, that is Dashmul Basti or any type of the Eranamuladi Basti, it is not that corrosive. So we give to Adarsh Prasruti Basti, right? And Madhutalika Basti also, there is Madanfal in the Basti. So because of which it may be given in low doses like Padahina Basti, and that is generally preferred in cases of diabetic patients. Okay, in those cases, Shodhana has to be there, Basti has to be strong, it has to remove the water contents from the body. So the dose is less. We are giving less doses and we are excreting maximum things out of the body. So there comes a role of rectum and colon. Okay, so rectum has its reservoir volume up to 300 ml. If it crosses above 300 ml, then we may get the pressure. The threshold is 500 ml. Up to 500 ml it can tolerate. Up to after 500 ml they cannot tolerate. Okay, so the Basti is always given above 500 ml. If it is Dwadash Prasrut also, that is actually 960 ml. Roughly we can consider it as a 1000 ml, right? So if we are giving Ardha Matrika Basti, which is one of the lowest dose, then it will go to 500 ml. So below 500 ml, if you are giving anything like this Chatuk Prasrutiki Basti or anything below that, that is actually meant for some kind of the healing due to the retention of the Basti. Okay, so if retention is needed, or any type of the means, suppose we are giving Picha Basti, that we can give in low doses. Okay, otherwise rest of the Bastis, they have to be given in some kind of the volume. Otherwise there may be longer retention of the Basti. Even Vaitran Basti, there is a practice of giving it in low doses if we need the water to be excreted from the body and we need Basti to get retained for the larger duration. Okay, then we can give it in low doses. I have seen many people giving it a dose of 300 ml like that. So they are intending actually to retain that Basti for longer duration. That is why in some Samhitas also it is given that the Vaitran Basti should be given after food. Okay, and that is the common practice. There we need Basti to retain for some time. It draws the water from the body, it removes it from the body, and it does proper cleansing of the colon. So for that reason, it should be retained. If normal Basti is retaining for longer duration, it may cause the Vata aggravation. In these cases, we can tolerate some kind of the Vata aggravation, but on in For that, we are giving arm from the body. So for Prasuta is 320 ml. That is the lowest dose which is given in Prasad Pramana Basti. Okay. So anything above 300 ml, it will cause motions. If you are giving below 300 ml, the basti may retain for longer duration. That may cause some complications also. Now, this is for students. Why basti is given after food. Okay. So this is a common experiment you might have done in your 12th classes, or maybe in science lab somewhere it is there. So there is a pipette. We put the pipette in some liquid. We suck the water or some liquid, and then we remove the that rubber bulb and we put a finger over there. And we, as we remove the finger, the water or that chemical that drips out. Okay, so that finger is actually creating a pressure, or it controlling the pressure inside the bulb and external pressure of the air that is preventing the leakage of the fluid. This is the actual mode of action of Anuvasan Basti. Our food that we are eating, or whatever is there in the gut, that is actually behaving like that finger, and we are not sucking the liquid, we are actually putting the liquid inside this gut. That gut is also a tube. So we are putting the liquid inside the gut, we are clogging it with that finger or in the form of food. So the Anuvasana can retain for longer duration. We need generally Anuvasana to be retained for 12 hours. Clinically, most of the time it is not seen, but at least 4 to 5 hours it is necessary. Now, if we say like this, then the guna of Taila are actually Vyavai, Tikshna, Ushna, and Sukshma, and all the Sneha have Anupraman Bhav. These properties actually helps the Sneha Dravya to move to the upper part of the gut and destroy the Agni. The food taken before Anuvasana Vasti prevents such type of the movement and will allow oil to stay and act in the Bhagvashaya and Guda. Hence, the Sneha is to be administered after food. This is the explanation what we can give, because Anuvasana, though it is a Malashodhana, it may have shaman kind of the effect on your Agni also. So it may diminish the properties of Agni because of the dilution, and this dilution should not happen. So for that reason, it is to be given actually after food. So now if this comes in the picture, and if we ask the patient to hold it forcefully, what will happen? So I hope everyone have experienced this. If we ask the patient to hold the basti for longer duration, there is a common complication called as adman. Okay, adman is very commonly seen if we are giving basti and asking the patient to hold it. We generally ask the patient what to, after giving the Anuvasana basti, whatever Paschat Karma is there, tapping the buttocks and all, then lie down in a supine position for some time, and then don't rush to the ward immediately from the Panchakarma room. Okay, wait there at least for 5 minutes. Okay, that is the time needed to get all the doshas and all the basti, whatever is given, to get it settled down. Okay, so because of that, your gut irritability or anxiety is there, na, that get diminished by that 5 minutes. After that, patient can move to the ward, and he may rest there. He should not walk a lot, or he should not be anxious. Otherwise, the basti may get removed, but he should not hold it forcefully. If he is holding that forcefully, then there is a problem. There is a Atman which is seen. So why Atman is there? Because of the so many things are there. Okay, so visceral hypersensitivity is there, increased intraluminal content will be there. So there are we are actually obstructing the outflow, and psychological issues are there, like depression or anxiety. These plays a role in formation of that Atman. Then it is difficult. We call it as a Vyapada of Basti Chikitsa, right? So this should not happen, and because of that, we should not hold it forcefully. Instead, what Acharya have tell, that is very correct. Repeat it. Repeat the basti. If you are given 90 ml, suppose in a through a glycerin syringe, that is not a highest dose of basti, right? Sneha basti we can give up to 240 ml, which is the highest dose, as we can see as a 1/4 part of that 960 ml. Okay, so 240 ml is the ideal dose for any Sneha basti. So up to achieving that 240 ml, we can give the basti again and again. That won't cause the complication rather than asking patient to hold it for longer duration. So give the basti for say it retains for 2 hours or 3 hours, then repeat the basti again if it is evacuated and give it again. Means you can give 2 or 3 times, right? So that is the classical practice what Acharya Charaka have indicated. Okay. Now see, there is a common thinking that Matra Basti is a very simple therapy. And generally, whenever we want patient, whenever patient is like that, he cannot move, he cannot do anything, and we are not able to give him the Yog Basti, then we go for the Matra Basti, right? But this is not always a correct practice. Matra Basti has its own indication and it has a superiority somewhere in some cases. Like I'm giving one example here. This is a case of compression fracture. Now, compression fracture is basically seen in menopausal women or osteoporotic patients or very old age patient. It is commonly seen. Now there is vata aggravation, and that vata aggravation is because of the rukshata in the body, right? Here the treatment is also sneha. Even Acharya says that in Asti Chikitsa or Asti Ashrita Chikitsa, Bastayaha Kshirasarpishi Tiktakopa Hitanicha. Okay, we have to give Tiktaras, Basti, Kshira, and Sarpi Yukta. Okay, so everywhere they are giving the indication that use sneha. Okay, now if they are telling that you have to use the sneha, then why to go for nirobasti unnecessary when it is not needed? Okay, now see, in such cases also, and even in cases where there is anterolisthesis, or there may be some listhesis of the any particular vertebra, or there may be some articularis defect. Like we commonly see in X-rays, there is a pars intra-articularis defect, which may be because which is causing listhesis of the vertebra. It is very difficult condition to be cured, right? You might have experienced these things because I also come across these cases. They need traction sometime, and if they are chronic, then traction also never works, and this patient comes to us, and we are giving Yog Basti again and again, but that never works. So in those cases, it is always good to go for Matra Basti, because Matra Basti is basically giving small amount of the sneha for longer duration that actually causes lubrication of all the organs which are there in the koshtha. I have given Basti in rats. I have seen that after giving the Basti, when I cut open the gut of that rat, all the organs, they are getting lubricated. Okay, so this is the thing that Matra Basti can achieve, which is not achievable by Nirva Basti. So if you give good amount of the sneha for longer duration, that is through the Basti, it will act like a sneha given in Apan Kala. Okay, so we can give larger amount of the sneha rather than giving it orally. We can give through the Basti, and it will be having added effect of acting over the Astidhara Kala. So that is why Matra Basti is sometimes superior than your normal courses of Basti therapy, right? So, is Basti Rasayana? That is also a one commonly asked question. For Rasayana, we have Chavanprash, right? We have so many other things which are mostly oral. But before doing Rasayana therapy, Acharya says that go for Vamana, go for Virechana, and then consume the Rasayana. There is nothing mentioned as Basti, right? So we may think that Basti has no role in Rasayana. But as we all know, when we learn about the indications of, Falashruti of Basti, Bastir Vayaha Sthapayita. It is the first sentence, first word mentioned for the Basti, right? So Vayasthapan is the property of Basti because it is Vatahar, and the increasing age is because of the Vata. Okay. So as the Vata increases in the body, this catabolic activities, they are increasing in the body. So to hamper that catabolic activities, we have to give the Basti, right? So Basti is actually the treatment for Jara. So we have to give Basti therapy. So this is this what we have tested for. Actually, it was in my PhD thesis. What we have done is we have given Rasayana Turna in the form of Basti, Kalka of Rasayana, Kashaya of Rasayana, tail is from Rasayana only, and everything prepared from Guduchi, Gokshura and Amalaki. So all the contents were Rasayana drugs, and we have given it in the form of basti. We have given oral also, okay, oral drugs also. But as you can see, there are some changes happening. Like this Rasayana basti is causing this catalase enzyme to increase, this lipid peroxidase to decrease, and superoxide dismutase to increase. So these are the changes which are showing that basti is exhibiting the effect of antioxidant. Okay, so the contents are also like that, but basti itself is having the role in exhibiting this property of rasayana, right? So coming to a very important part, how to achieve the utlesha in case of basti. So what is utlesha? Basically, utlesha is bahirgamanonmukha of dosha. Means dosha should come out of the body. The environment that we create for this thing to happen, that is called as utlesha. Utlesha is not increasing the dosha. That is what I have to clear here, because in cases of vamana, Acharya says that giving kafotleshakara ahara. He never says that give kapha vruddhikara ahara. Okay, so kafotlesha is achieved generally through the ushnaguna, right? So ushnaguna, as you can see that this is a ice piece which is actually having solid nature, that I cannot, if you are putting that ice on my hand, okay, it cannot go out without increasing it. Okay, so if I give the heat to it without increasing the volume of that water, it is getting spreaded and it is getting removed. Okay, so this is the concept of utlesha. So that is true for basti also. In case of basti, Acharya have given one utleshaka basti, right? So the contents in the utleshaka basti, they are basically irritant to the colon, right? So irritating the colon is also a thing that can cause the direction of the dosha from shakha to the koshtha. That is also a part. Otherwise, the other way of utleshan is anuvasana, because anuvasana basti is a type of snehana, right? So if you are giving snehana, it causes utlesha of the body, because snehapana is actually meant for the utleshana of dosha, right? So snehapana, after that this utleshana, and then we go for vamana. Similarly, anuvasana, after anuvasana, we can go for basti having such type of the utlesha drug if the doshas are seated very far. Then this utleshana type of the basti is needed. If dosha are about to remove, or if they are themselves coming out from the body, then we don't need utleshana. Then we have to give the shodhana type of the basti and then shamana type of the basti. However, practically it is not followed anywhere mostly. There are some research practices of giving utleshana, then shodhana, and then shamana. However, we generally go for directly a single type of the basti, right? So what we can do is give anuvasana and then give niro basti. That is the yog basti, kala basti, and karma basti. Or what we can do is utleshana we can achieve with increasing the number of anuvasana. You can increase the number of anuvasana and then give one niroha. That causes utlesha, as we do in case of sarvanga dhara. In sarvanga dhara, what we are doing, actually we are doing daily the dhara, okay, or pidichil. So because of the pidichil, dosha get utlishta. Okay, so that utlishta dosha we have to remove. So we generally give anulomana like Gandharvaritaki or Sankalpa like that. So instead of that, you can give basti also, right? So this type of the therapies combined with basti, they can give utleshana effect. And even the snehana svedana, what we do before basti, that is also a utleshana, right? So can anuvasana be given at night? Okay, this is a very important question. According to Acharya, it is not indicated, because nishi anuvasana, this is what pundarikena sadrusham hridayam sad adomukham jagratastad vikasati swapatasya nimilati. So actually, because of the heart activity that is getting reduced due to the tamoguna, the Vyanvayu won't be there to help us, and because of that, the anuvasana, the anupravana bhava of the anuvasana won't act properly. That is why it is not indicated. However, if you are willing to give the anuvasana in such cases where you don't want the help of Vyanvayu, you want local action, okay, in such cases it is okay, right? So in such cases, that is okay if you are giving basti. Or Acharya have given some instances like Sharad, Grishma, and Ghanagameshu, where there is excessive heat in the environment or excessive some means environment is not favorable, because basti has to be given in a summer rutu, right? So if rutu is not favorable, then you can go for anuvasana in ratri. Okay. Otherwise, it can cause the ama production. So only thing you have to keep in mind is am should not be produced. Okay. You can give the basti in nights, but if you don't want the help of Vyan Vayu, then it is okay. Or that basti is not producing any kind of the ama, then you can combine the basti kalpa with some kind of the pachana drug. Like you can add some shunthi like drug, or you can add some sandava like drug. Okay, so that can make it more like a shodhan. Okay, so even you can use some sandavadi, brut sandavadi tel like kalpa. Okay, so these are the things that you can use, right? Okay. So, is it necessary to always follow the Yog Basti, Kal Basti, and Karma Basti pattern, or there is any other classical way of giving the Basti Karma? Okay. So, actually, Acharya had given this Yog, Karma, and Kal, that is to achieve the clinical benefits. Okay, rather than having some complications. So that is why it is a standard method. However, you can modify it. Acharya have given indications like yoge niruha traya eva deya snehascha pancheva paradi madhya. So you can give 3 niruha basti continuously, and then you can give the anuvasana. Okay, or even you can convert this thing. Yoga basti you can finish in 5 days. Like you are giving niro in the morning, you can give anuvasana in the evening, and then again you can give in morning niro and evening anuvasana. Like that you can finish the niro basti, yoga basti in 5 days. Or even you can change the sequences. That is always indicated. It is not like that Acharya have contraindicated this thing. The yoga, karma, and kal is just for easy to do things. Okay. It is not always true. We are giving most of the bastis continuous niruha. Like in those cases, like complications of diabetes, or in cases of kidney disorders, where there is anuvasana is mostly contraindicated. We never give anuvasana. We directly give niruha basti continuously, and that is also having good effects. Even Vaitran basti is the best example, where there is no anuvasana needed. We can give continuously nirobastis, okay, and it is having good relief. Okay. Now, so in summary, we can summarize the mode of action of basti as it is majorly having the property of shodhana, that is colon cleansing. It is having the property of enteric nervous system stimulation, because if I was talking about this enteric nervous system, I'm basically targeting the diseases of nervous system, like those which are related to some kind of the what you can say directly nervous system related disorders, or indirectly, like in cases of psoriasis. Okay, so there are some indications of basti in psoriasis also. However, it is not the prime therapy at all. We go for Vaman Virechan or Raktamokshan majorly, and if needed, if in cases like psoriatic arthritis, we go for the basti therapy. Right? So absorption is a very small part of the basti mode of action, because contents of the basti do get absorbed. We have seen in some experiments. This was one experiment we did. We have shown that basti contents, they are getting absorbed. Okay, we have seen with some marker. So it is there, but still the mode of action of basti is not because of the absorption, because we can give more quantity of the drug through the oral route. However, through the basti, we can administer though we can administer in a very larger quantity, but the amount that is getting absorbed actually, as per the concentration, that is actually very less. Okay, so that thing is not going to give that much clinical effect. However, if there is a problem in gut somewhere, then you can go for the basti as a route of administration of drug, but actually it is not. Okay, so very small amount of the drug is getting absorbed, and that is also having some kind of the effect. Okay, so major effect is coming through gut cleansing, that microbiome theories, and the enteric nervous system like things. So these are the major parts of the mode of actions of basti. So is there any other method of giving basti therapy? This is also a very important question, because I have seen in some colleges, they are giving some there are some practices like Rakta Basti or giving some type of the Basti, which are there in very less doses because the availability of the drug is not that easy, right? So they are giving in less doses and they are using drip methods. Okay, so these are also modified methods of giving Basti just to make it to retain for longer duration. And that is very true. As we are telling, 300 ml is the threshold of the rectum. If you are intended to give less amount of the Basti and you don't want it to get out from the body very immediately, then you can reduce the dosage. You can give in the drip methods, give him drop wise, okay, so that it can get absorbed. But this is when you cannot give the drug orally, then this type of the things are there. Okay. Now, so preparation of the Basti. This is very important thing. I have prepared Basti in mixer also. I have used blender also for preparation, and majorly we have used kharal. Okay, so why to use that kharal kind of the thing if we have such a technology right now? So you can transform that kharal into a machine, that is okay, but using mixer, that actually having the means whenever mixer it is having more number of revolutions per minute, that is good thing. So it makes the Basti very easily, but it breaks down the particles. Actually, if you see under microscope, the thing that is broken down with blade, it has a talcum powder like structure, irregular type of the structure. The molecular, whatever the calca you are putting, whatever the means whatever the particle drugs you are putting in the Basti, that get broken down actually, and that is not getting absorbed properly. So if you are intending for good absorption or some good action because of the emulsion property of that Basti, then it should have a spindle shaped particles. So for that reason, Niruha Basti prepared in kharal is best. You can modify that kharal into a machine, that is possible, instead of using a mixer or blender. But if you have less time in your clinics, definitely you can go for mixer and blender. There may be 10% of the difference only in your clinical efficacy, I'm telling, though it is not conceptually correct, but clinically I have not seen major differences. Clinically, the Basti prepared in mixer also works well. The only thing you have to follow that Makshikam Lavanam Sneham Kram. First add Makshik, then add this thing Sanda, and then add everything Kram wise. Okay, then only that emulsion is found properly. Actually, our motto is to prepare a good emulsion that can adhere to the wall of the colon and that can have the good effect of the Basti, total effect of the Basti. So if you are preparing in kharal and you are doing revolutions per minute very fastly with your hand, then Basti can be prepared in 10 minutes, right? But if you are moving your hand very slowly, then it can take up to 45 minutes and need more efforts to mix the content. So, and another thing, you can add sneha very slowly while making the Basti. By drop or spoon by spoon you can add. That's why the Basti can get prepared very fast and effectively also. Okay, so your wrist movement is very important. Rather than putting complete hand and moving it very fast, simply you use your wrist and move that kharal very fast. Okay, so spindle shaped particles are absorbed more readily than those irregular shaped particles which are prepared in mixer or blender. Okay, so sorry. Yeah. So nowadays, in most of the cases, it is possible that the yogas mentioned in Charak Samhita, they are not available. Okay. So if it is not available, then what to do? We can have only Dashmul Kwat very easily available. Erandmul Kwat we can have easily available. You can prepare Mustadi Rajapan for your patients for like say for year supply you can prepare. But every Basti is not possible, right? It is not technically or economically it is very difficult. So what you can do is simply those kashaya which are available in oral form, those you can use in Basti. Okay. Because those kashaya are also herbal medicines. Only thing you have to keep in mind, there should not be anything corrosive or very corrosive, which is not good for gut health. Okay, because gut health you have to see always while giving the Basti therapy. So if there is nothing harmful in that, then definitely you can go for these type of the things. Nowadays, we are having some cases like this thing, avascular necrosis of femur. We are seeing so many cases. I don't know, after some people are reporting that after COVID, this increased suddenly, or some kind of the reports are there. So many patients are coming, and we are having some drugs, like we are giving a basti in where we are using basically the Manjishtadi Kvat. Okay. Mahamanjishtadi Kvat we have, and along with that, we are using simply Dashmul. Okay. And we are using Shir Kashaya out of it. Actually, the contents used in Manjishtadi Kvat, they are having Tiktarasa property. So we use those kind of the drugs in such patients, and we prepare a Kshir Basti out of it and we give in such cases. And it is having very good results in that, because it is having Rakta Shuddhika property also, and it is having Tikta Rasa also, which boosts the bones. Okay. So this kind of the modifications you can do. Even see, Panchatikta Kshir Basti is one that is used classically by every practitioner. But suppose there is an osteoporotic female patient. Okay. So in those patients, if you are using Shatavari instead of Tikta Rasa, this Panchatikta, that will be more beneficial, because Shatavari is having Madhur Rasa along with Tikta Rasa. Madhur is also Bruman, Tikta Rasa is good for this Asti Dhatu, and even the Shatavari is having some kind of the inbuilt this thing, estrogen hormones. Okay. So estrogen boosting activities it is having. So if female patient is there, it is osteoporotic, then you can use Shatavari instead of using Tikta Rasa, like classical Panchatikta Kvata. So according to the indications of that particular Kashaya, you can use. Likewise, we are using same Manjishtadi Kashaya in case of Pakshaghata patient also. Now, it is very rare that people use Manjishtadi Kvata for Pakshaghata. But see, it is indicated in Prasupti, Pakshaghata, right? Medo dosha, Netra roga. So many indications are there. Nowadays, we are seeing all these patients only. Vatrakta, uric acid we have, Prasupti, this neuropathy patient we have, Pakshaghata patient we have, Medo dosh, the blockages here and there. There are so many patients. Netra roga, so many patients are there. So Manjishtadi can be a part of my kitchen of this Panchakarma Basti preparation, right? So likewise, you can use so many Kashayas. Now, there is one more important point to discuss, that is Mamsa Rasa in the Basti. So, you may think that we are adding Mamsa Rasa to give protein, which is completely wrong. We are not giving Mamsa Rasa for protein, right? Because what happens is protein cannot be absorbed through the colon. If it is getting absorbed in some way due to that leaky gut, and protein is getting entry, exogenous proteins like Mansa, if they are getting entry, then actually they may trigger the autoimmunity, or they can cause, in some cases, they may cause shocks also. Okay. So it is not at all indicated to get this Mansa Rasa, the protein part, to get absorbed. Okay. So why we are adding Mansa Rasa in the Basti? See, Mansa Rasa is indicated in Vata type of the disorder as a Prakshepa. Okay. So if we are giving Mansa Rasa, actually we are giving very easy to digest Sneha, right? It is the Laghuttam Sneha, and it has a collagen inside. So it may boost Asthidhara Kala indirectly. Collagen is basically fiber. So it is a nourishment to your Asthidhara Kala, the gut microbes there. That is also one thing that can happen. But basically, proteins are not getting absorbed. Here only the Mansa Sneha. Actually, it is Vasa. Okay. So that Vasa part is getting absorbed through the gut. And that is the easiest form to administer the Vasa. Vasa, if you purify from Mansa Rasa and you administer the Vasa to the patient, it is very difficult to digest. It has Agni Mandakara property. So it is very difficult to give to the patient. So we are using it in the form of Mansa Rasa, where Vasa becomes very easy to digest and it is getting absorbed very easily. Okay. So there are so many essential amino acids and all present there, but we need only this thing, the Sneha. Okay. So this is all I know about the Basti conceptually. There are so many clinical indications of the Basti. If you have any questions, we can discuss those. So Thank you.
Thank you, Dr. Swapnil, for such an elaborative and informative lecture. And now there are the questions in chat box. You can directly answer the questions, or the
Okay.
question who asked the question, they can raise the hand. They can ask directly to you.
So I can see there is a question like Anuvasana in Nishikal causes Utlesha. Can we administer Anuvasana prior to Vamana day to promote the Utlesha Avastha? So many clinicians do so many practices. I have not practiced this thing, but as far as I know, the Utlesha has to be there in your upper respiratory tract. Okay. So if you administer the things orally, that can causes the kapha utlesha in your upper part, okay, rather than giving the basti and waiting, because if you are giving basti rectally, it may take time to have that utlesha effect and all. So and gati of the dosha will be to the lower side, and the utlesh will be in the lower part of the colon. We don't want that. We want dosha to get removed from upper part of the gut. Okay, so I don't think this is correct option. The difference of opinion may be there. So actually, we give orally the things that is mentioned in classics. Can you elaborate some examples of Utlesana Basti which can be given in different conditions? Okay. So Utlesana Basti is a classical Basti actually given, that is a type of kalka. What we follow, we never get that hapusha actually. That is not, that is a controversial drug. Okay, so we never get that. So what we do easily, we have a very beautiful drug called Madanfal. Madanfal is a very good drug. If you use it properly in Basti, it is one of the important drug to be used in Basti. Like in Eran Muladi Niro Basti, it is mentioned. In your Mustadi Rajapan, it is mentioned. In Madhutalik also it is there. So the role of that Madanfal is also Utleshan. You can use some drugs like Pipli, or you can use some kind of the irritant drug as per the disease. If you are getting some pitta type of the disorder, then there is no point of using such kind of the irritant drugs. Then your drug may differ. But we generally use this type of the concept in cases of rheumatoid arthritis, where I personally use Madanfal and Ajmodadi Churna in Basti. Okay, so that causes some kind of utleshana, and a patient get relief sooner as compared to the other bastis. If Vaitran basti is not my choice, I'm going for some other basti. If patient is chronic, there is pain dominant condition is there rather than Shoth dominant condition. In such cases, doshas are seated very far. They are in lean avastha. We have to do utlesha, but we should not give Vaitran like basti, which causes a lot of evacuation. The pain may increase because of that. So in those cases, we go for normal basti like Dashmula or something. We just modify the kalka there. So in Kalka, we use this kind of the things, Madanfal or this Pipli or Ajmodadi, something like that. Especially you have to use those things which are mentioned in Amba Chikitsadika. I follow Yogaratnakar for that. I use directly the Kalpa from there, and I add those things in Basti.
One more question.
Okay. Understanding Basti, mode of action of Basti in Vatrakta, like is it removing excess uric acid or correcting the purine metabolism? Basti has nothing to do with purine metabolism. Actually, it is a byproduct of your proteins, what you are eating, and there is means kidney is not working properly. Okay, so Basti has a role on kidney. It is not having direct action on uric acid. Only the thing is Guruchi, what we are using in Basti, that is having direct action. Okay, you can see simply one thing. You open any chapter of Charak Samhita. Suppose if you are learning this uric acid like thing, like in Vatrakta, okay, Vatrakta may be anything, but suppose here we are considering Vatrakta equal to hyperuricemia, okay, gout. So we open the chapter of Yogaratnakar, we just go through the Kalpa, what drug is mentioned again and again and again and again, that is Guduchi, okay. So Guduchi is a prime drug for that. So use Guduchi in Basti. It is having some action through the absorption, and it may have some action through that microbes also, because Guduchi feeds specific kind of the microbes only, and that may have some indirect action. Okay, so there is no direct action on uric acid as such. Pattern of Basti matters because sometimes due to their personal reason, Basti gets stopped in between. Do they have any side effect? If so, how to manage, sir? Okay, so Basti actually is a very beautiful therapy. If you stop in between, nothing happens. Okay, But suppose pattern of the basti is actually important. Acharya have clearly stated that Vat Prakop should not be there and Agni Manda should not be there. Okay. So to stop those things, this yoga basti kind of the thing is mentioned. If you can clinically assess the patient very well, then there is no need to go for Yog Basti or Kal Basti. You can go on giving Niro Basti till you see any type of the Vata Dushti symptom. You have to be means a little bit very much near to the patient, okay, to observe those things. If there are some symptoms which is causing these kind of the things like Vata Prakopa is there, then you have to immediately administer the Anupasana. We do in this case of Vaitran Basti. We go on giving Vaitran Basti again and again, and if you see there is some kind of the Vata Dushti is there or if pain is increasing, we immediately administer the Anupasana in those patients. Okay. Mamsa Rasa, what can be added as a avapa instead of Mansa Rasa? Okay. To get same effect like that of Mansa Rasa in case of Pakshagata or infertility, such condition. Okay. Mansa Rasa, it is having a specific type of the property. That's why Acharya mentioned Mansa Rasa. Very less substitutes are available. However, Sneha we are already using in the Basti. So if you can't use non-veg things in patient, avoid Mansa Rasa, no issue. Instead of that, use Sneha, whatever there in the Basti, use it wisely. It should not produce any kind of the arm. It should be easily digestible Sneha. Okay. Milk is other option that is for Pitta, and Gomuktra is another option that is for Vata. Or you can simply use Dhanyamla also. Okay. Dhanyamla is indicated for Vata, but it is having Ruksha property. So you have to use in those cases where there is Ama association along with Vata Dushti. So there you can go for it. But Mansa Rasa, it don't have that. I cannot tell you something that can replace the Mansa Rasa because it is very easily available and really it is having good effect.
Namaste, sir.
Namaste.
Sir, there is a case of L1 compressive fracture.
Compression fracture.
So we are planning, we are planning Panchatikta Kshira Basti with Anuvasana as Murivenna or Ashwagandha Bala Lakshadi Taila with Mamsa Rasa.
Yes, definitely. It is a good therapy.
So whether it is can we add only fat or it is advisable only to use Mamsa Rasa for the Anuvasana, means for the Basti, sir, as Avapadravya?
Yeah, Sneha is always there, na? So Sneha is there in the Basti. Mansa Rasa is a Avapa Dravya. So Mansa Rasa is good. If you use Mansa Rasa, that is the correct one. Okay. Anything else you can add in the form of Kashaya? If it is some kind of the, like I have seen one Basti in, I think there is reference from some Samhita, I don't know exactly the reference, Sharandar or something. They use Godhuma Kashaya. Okay. Someone is mentioning Masha soup as a Avapa. So no need to go for Masha as a Avapa. Masha is actually a drug of Kashaya itself. So Acharya, there is one Basti in classics also for Bhagna Chikitsa. They have mentioned Godhuma Kashaya. Godhum is actually what we use, Gehu. Okay. So you have to prepare Kashaya from Gehu and you have to use it in Basti therapy. So Kshir Kashaya we can prepare. Godhum and rice, both are very good Sandhanakar Dravya. Okay. That can be used in Basti and there is classical reference for it.
In Bruhattadi Apan Basti, these two drugs are there in the Kshir Kashaya. Okay, now I think we have, Dr. Swapnil has already covered all the questions. Okay, if anybody else again having question, they can directly ask to the Swapnil.
Yeah, there is one very important question in the chats I have seen. Nasya and Anuvanasana at the same time, very much contraindicated.
Okay, okay.
This classical contraindication for that. Some people do like this. They give Anuvasana at different time and Nasya at different time. There is one practice. I don't know the clinical implication, but we follow the classical things while going Basti therapy. There is no need to go for Nasya. Okay. If it is very much indicated, then you can do like different times.
No, but it is written, no, like no, na guda kanthabhyam payas neham. Matlab it is a classically it is contraindicated. Yeah. So thank you, Dr. Swapnil, for such an informative and very nice lecture on the Basti. Of course, our students are so happy, and many experts or stalwarts who have joined online. Like I would like to thank them. Of course, Dr. Nandini, the better half. Thank you, Nandini, for joining us. And Dr. Karishma from Delhi. I thank you, Dr. Karishma, too. Mamta Madnaik ma'am from Maharashtra. And I think Dr. Muthu from Chennai. Thank you, Dr. Muthu, for joining us. And Dr. Vandana from Bangalore. And Dr. Sujata from CCRS. On behalf of Department of Panchakarma, I thank you all for joining and making this lecture series a success. Thank you all. And Dr. Swapnil, thank you so much.
Thank you very much.